6 years old that
Yeah.
just went through the cracks.
Yeah.
What would you say to these parents to get this kid to get, because sometimes these kids are in wheelchair bound, they can't sit up correctly. Should they just go along with that, or should they try to do something to get the kid to do a little bit more?
6 years old in a wheelchair, and it is the diagnosis, and for me, it's not if not a progressive disease, it's not other contraindication, like autogenesis imperfecta, all kind of things. If the child is there and 6 years old and is not taking the CME therapy, I will say to the parent, let me try, let me evaluate, and let me show you if we can do something, if we can lead the energy of the child to some functions, and I will try.
Do you ever give up?
Yes. If I give up, if in traditional concept, in 8 weeks it's not changing the child, I say my therapy is not good for you. But now, after years of experience, in 4th session with no change, I say sorry, I'm not good for you. Look for another hand.
Could be that maybe the techniques you have developed are going to get to another level down the road, and maybe some of those kids we can't get now, maybe we'll find ways?
It is possible.
It's possible.
It is possible because actually I have a limit on my creativity, I have a limit on my action, and that's because I say when I fail for session, look for another hand. I cannot go ahead with.
So in other words, you're being honest about it.
Absolutely, of course, it's the only way to work with the children, not for the money.
I've gone.
They don't have energy.
I know that. I've gone to a lot of different people in different areas, and the one thing which I find is the most important thing in anybody say, I can't help you.
Absolutely.
And that's an honest answer. The best teaching pediatrician I ever met was Sidney Gellis at Tufts, and he used to tell you, sometimes at a conference, we made a mistake in evaluating a child, but we were capable of recognizing it, how we changed from what we were thinking to something that was better. Very few doctors are capable of ever saying we're wrong. And sometimes you learn more from not doing the right thing, but being capable of recognizing.
Absolutely.
So
And
sometimes the negative feedback is more valuable than positive.
Absolutely. I do believe on that point of view, and I say in my courses to my students, be your own judge. Look yourself from behind and put in the balance, what are you doing? Are you getting something? Are you really making honest progress? It's very important, because we need the good energy to work. We cannot go this in taking like a business.
So if you saw 10 patients, all different types, at a session, what percentage of kids you think you can make a difference a little bit?
Honestly, 70%.
So that's a good answer, because some would say 100%. Now, the ones that you don't make any progress with, is it because we haven't found the right way to do it, or they just can't be helped?
Honestly, I think that I didn't get the right way to do it, and the person can do it.
But maybe somewhere along the way.
Maybe also the brain needs more time to absorb my therapy, so many things. But in my principle, if I succeed, I say good for the brain. You did it, guy. You did it. If I'm wrong, I say I make a wrong choice. So never blame the child. We need to do it.